Okay, now we're going to look at the chemical mediators that the cells release either alone or in combination that could cause allergic symptoms. Things like histamine, serotonin, prostaglandins, bradykinin, all of those. And the targets are usually your skin or your upper respiratory tract or your GI tract or your conjunctiva. And that's going to cause you to have rashes and itches and redness and rhinitis, sneezing, diarrhea, and of course your eyes will water. And rhinitis is associated with the nose, so it's inflammation of your nasal cavities like a sinus infection would be. Now, the systemic targets of these chemical mediators are smooth muscles, mucous glands, and nervous tissue. You can have vascular dilation or constriction, and that can cause your blood pressure to change and your breathing, your respiration to change. The diseases associated with these type 1 allergies, the atopic disease, like we said, that's hay fever, rhinitis, it can be seasonal when you inhale it or come in contact with it or ingest it. And if you have allergic asthma, of course you have bronchoconstriction. And an example of atopic dermatitis would be eczema. You could also have food allergies if it's coming in through the skin or through the intestinal portal. And it can affect your skin and your respiratory tract also. So you could have vomiting, diarrhea, abdominal pain, again, eczema, rhinitis. Occasionally you might have anaphylaxis, like people that have peanut allergies. You hear about this. Drug allergies. This could be a side effect of the treatment, and it can affect any tissue. And it can be just a mild reaction, some mild atopy, or it can be fatal, anaphylaxis. This is a picture of atopic dermatitis or eczema. This is just a skin rash. Now, to talk about anaphylaxis a little bit, it's a reaction when animals are injected with a foreign protein, and you can show acute symptoms like itching, sneezing, difficulty breathing, prostration, convulsions, and even death. And there's two types in humans. There's cutaneous anaphylaxis, where you have a reaction right at the local site of the injection of the allergen. And then there's systemic anaphylaxis, which is, of course, going to lead to anaphylactic shock, where you have this sudden respiratory and circulatory disruption, and that can be from bee stings or antibiotic injections or antibiotics or things like that. Now, to diagnose an allergy, if you've ever been to an allergy doctor, they do skin testing, and they actually will prick your skin. You map out your back, and they prick your skin with a little bit of the allergen, and they watch for a reaction to see if you're showing any allergic reaction to that particular allergen. And of course, they're aware that you could have severe reactions and anaphylaxis, so they're constantly monitoring it. And it of course, would be a cutaneous pathway.